same thing, we're going to keep it the
Hi,
breath. And on the
I'm
exhale,
Erica. I'm a
we'll go to
student
back
physical
right.
therapist. Is it okay to work with you? Okay, very good. So just gonna review a little bit about your chart here. So you're a 56-year-old female. You're having some significant secretions due to your diagnosis of cystic
So I could also
fibrosis,
stay in this,
respiratory
we could also have you stay in
infection,
this position.
having a lot of
5
secretions,
to 10 minutes.
had a
and I can
history
also
of heart
perform the
attack,
vibration for,
as well as
3
leukemia
to 5
and some
minutes,
peripheral vascular
with
disease with
instillations.
diabetes as well. So
And then I'm
quite a
gonna
long
do
history there. You
breaths.
doing okay?
This side facing me.
Okay. So one of the things I want to do, since you're having a lot of those secretions, is you're might be having some trouble getting those things out, up and out of your lungs. So we're gonna work on some stuff like that. So first off, before we get started,
If that were to
can I
start,
see how you
bringing
would
some
cough
things
for
up,
me?
we could also use some coughing techniques.
Okay,
To help bring
okay,
the
so
secretions.
we're gonna work on a technique to help get that a little bit deeper, so you can have a more
So
productive cough.
now,
Okay, so what we're
like I
gonna
said,
do
I'm gonna do some things
is
that
I'm gonna
help
have you
assess,
lay
how
on
well,
your
you would, be under
your left
you had
side.
undergone
Okay.
surgery. So 2 of those things are gonna be the Carlson comorbidity
Okay,
index,
there's a pillow
and then
for
the
you.
short
I'm gonna raise the
physical
table, but I'm also gonna get
battery.
a pillow for your knees.
So, I'm going to
Here you
talk
go.
conversation here about your Carlson comorbidity.
And let me see.
So,
And actually, Lauren, I'm sorry. Can I have
Position.
you sit back up?
So the
We're gonna,
purpose of the
I'm going
Carlson
to elevate your
morbidity
feet
index
here.
is to determine the 10-year survival rate, or 10-year survival in patients.
Okay, and then I'll just have you lay on your left side. So we might just have to, might just have to pivot
to estimate a
Perfect.
10-year survival rate.
Sorry about that.
So,
It's okay.
in Josh's case, he had
Okay, so the first thing I'm gonna do, I'm gonna elevate your feet first.
he has
I want you to tell me if you're having any
2
dizziness
points.
or anything, okay?
He has peripheral vascular disease, which is 1 point, diabetes, which is 1 point, and then his age, he is 56, that is 1 decade above the age of 40, so that is 1 point, and then he has chronic pulmonary disease.
Took me a second there. Okay.
It's a 7.
Alright, so with that, I'm
This
gonna
is
have you
4,
scoot your
and
hips
that
down a little bit.
indicates,
Perfect,
an
just like that.
estimated 0% chance of.
And then from here, I'm gonna lower the head
Again, I'm
just a
saying
little
this
bit.
to position, not to demonstrate. And then next, the
Okay.
the short.
Alright,
physical
Lauren, how are you
performance
feeling
battery.
here?
So I'm gonna
Good,
just
okay, so what we're
up
doing
front.
is we're draining that right side.
And so we're gonna be doing a series of balance, transitions, and.
Okay, so while you're in this position here, Lauren, I want you to take a nice deep breath in. Good, and breathe out for me.
So
Good. So next time you breathe in, I want you to really push your tummy out, so do kind of like a belly breathe. Inhale, push your tummy out.
I'm gonna start a timer. So
Good.
first, I'm gonna have you stand
Exhale back in.
with your feet nice together.
Good job,
All
Lauren.
the way.
Okay,
Yep. And then we're gonna go for 10.
so we're gonna
seconds.
continue doing that for about
Good.
10
Good.
seconds. Okay, and then the next thing we're gonna do, I'm gonna have you just breathe normally. Good. Okay,
And
take
nice.
another deep
Okay.
breath
So
in.
next one, you're gonna put your right
Good.
heel just where your.
So what I'm gonna do
your
here is
left
give you
big
some
toe
vibration,
is.
okay?
Yep. Perfect. We're gonna do this for another 10 seconds.
Doing okay?
Yeah.
Okay, can you speak for me?
Yeah.
Perfect. So that's exactly what it should feel like, kind of a shaking sensation.
So, and then last
Okay,
one.
and I would do this for
you're gonna
about
put
5
your right
minutes.
heel in front of your
3 to
left
5
toe.
minutes for good
There you go.
benefits.
Alright.
We're gonna stop here.
Seconds.
Alright, so now Lauren, just go ahead and breathe normally for me. Good. Okay, and we'd stay in this position here if you can
Good.
tolerate it for
Okay.
about
So,
10 to 15 minutes.
Josh got all
Okay.
4 points.
All right,
on
Lauren,
that
I'm gonna go
portion
ahead and
of
raise your head up.
Short physical performance battery. And next, we're gonna come over
Good.
and walk a little bit.
So your feet here.
Stand
Good.
right here.
Doing okay? Alright, whenever you're ready, I'm gonna have you sit up for me. Let me move this pillow. Good. Okay, and take your time. How are you doing here?
So now, Josh, we're gonna
So
be
now what we're gonna
walking
do, Lauren,
all the way
is I'm
to
gonna
the
have
other
you
side of that other
lean
piece of tape.
forward.
And I'm
So
gonna
let me lower this table. So we checked the lateral side of your lungs, or kind of the right side.
Ready?
So now we're gonna check more of the back part of your lungs.
Yeah.
Okay,
We'll
so
go
I'm
this
gonna have
way.
you hold onto a pillow for me. I want you to really
All right.
lean forward.
So now we're
There you
gonna do
go.
the same thing, we're gonna
Perfect.
go to the other, that little plate there. Ready, set, go.
Okay, so we're getting more of the top part of your lungs,
Good.
but also kind of the back part as well.
So,
Okay.
Josh
Okay.
was,
So I'll go ahead and just do one at a time here.
you can go ahead and sit.
I'm gonna do a quick percussion. So what this is gonna feel like, Lauren, my hands are gonna be cupped like this, and it's just gonna feel like a loud, kind of a loud sound.
So,
Okay.
according to
Okay.
the clock,
I want you to let me know if this is too painful or if I need to
so
be a little
he
bit
scored
lighter.
all 4 points on that as well. So now, Josh, we're gonna do, it's called the
How are you
5
feeling here?
So we're gonna be,
Kind of feels like a
arms
massage.
are gonna be crossed,
Good.
you're gonna stand up and back down, and that's
Okay,
one.
I'm
as fast
actually
as
really
you
gonna
can.
work this side.
And I'll time you, okay? Ready, set, go.
And you can do a different technique where you can relax your wrists and do this as well. Still doing okay, Lauren?
And this time was
Okay.
8:56.
Very good, I'm gonna relax here.
So
So I would also do
is
that for
less than 11.
about 3 to 5 minutes to
Which
see if that would work.
Gives him,
Go ahead and lean on up
full
for me.
12 points
Sit up
on
nice
the
and tall.
battery.
All right, Lauren, I want you to try and cough for me.
And that indicates that he is in the best physical
Good
performance,
job.
and
I
good
feel like you got
quality of
something
life
up.
and very
Yeah,
well
it actually
mentality.
kinda did.
Good.
Um,
Good,
next,
good.
we're gonna talk
Okay,
about,
good job, Lauren. You can
a
hand me
few
that
things
pillow
regarding
here.
your heart rate.
Let's see what we're gonna do
So-
next.
We want to keep you. It says your resting heart rate is 60 beats per
Okay.
minute, and your physician
So,
would
did
let me
that,
know that
did
your
that.
max heart rate was 145 beats per minute.
Okay.
So when you exercise,
Make sure I got everything here.
40 to 60% of that
Okay,
max heart rate.
so
And so
I've
in
talked
order
to your
do
doctor
that,
a little bit, and
there's a
he's
little
talking about
calculation,
surgery
the
for you.
carbon
But
method,
before we get started on that, I'm
figure
gonna
out
probably
what
give your
that
doctor a
range
call and let him know some
So,
findings that
your
I have.
range is 94
So,
to 111, and I found
And this is
that
just
by using
education for you.
the resting heart
This
rate.
is what I'm gonna tell the
plus the
doctor.
percentage,
We're gonna
which
look
is
at
either
something
40 or
called the
60%.
Charleston Comorbidity Index. So that's just
times
testing
the,
frailty, which just
The
means
difference between your max and your resting.
kind of looking at
So that got
comorbidities,
me
so
to
like,
94. So that's where
heart attack,
if
things
you're
like
working
that.
out, we want your
So,
heart
based
rate
on
to be
your information
between
here, your
94
age
beats per minute
56,
and 111
you got a
beats per
point there.
minute. That way
Heart,
we're not- we know
heart
we're
attack,
not
you got a
target
point
range.
there. Leukemia, that's 2
So,
points.
Some activities that you can do
Peripheral vascular disease,
to
1 point.
target that range,
Diabetes is 1 point, so that's a score of 6.
so that we know
So
you're doing
according to
something safe
that,
and there's no contraindications
The Charleston
happening.
Comorbidity Index
Slow
kind of
walking,
predicts your risk of
keep you in that range,
death from multiple
maybe avoid really
comorbidity-
big hills, that way your
comorbidities.
heart rate doesn't
Also
spike.
predicts a
Even
10-year survival
gardening,
rate.
like working
So
outside,
according to this, you have a
good.
2%
And then
estimated
even,
10-year
like,
mortality rate to age
Some of those bikes
66.
that have like
So that's
motors
pretty
on
good,
them could be
actually.
good.
So,
Even avoiding big
Yeah,
hills
so
that
you're
you
definitely gonna
can
see
ride,
age
so
66, so
very
that's very good. So I will take that into consideration. I'll let the doctor know and
kids
we'll
and everything.
proceed with surgery if that's
So
what you guys
if
decide.
find a way
Cool.
to
Okay?
work out when
All right.
time in your schedule, when you have natural breaks in your
Okay,
schedule.
so now what we're gonna
that'll
do,
be
Lauren,
a lot easier.
we're gonna go ahead and test your lower extremity strength. So that just means testing your legs,
If you have to pull
your
away
strength,
from
your
the too loud,
balance,
it'll make it
the
hard
whole
to do.
9 yards.
You
Okay?
can also work in groups.
So,
there's yoga class
to
or
do that,
a workout class that
it's
you can
gonna be
do
called a
as well.
short physical
Really
performance
will,
battery.
Actually get it done.
And
then
basically I'm
lastly,
just gonna read you, give you instructions, and I'll have you mimic what I
If you like
do.
listening to
Okay?
podcasts or
So the
maybe
first thing we're
watching
gonna do
TV
is
shows,
balance. But before we do that,
or walk
I wanna make sure you're safe. So let's put a seat belt on you. And this is just for your safety
Sound good?
and protection.
Yeah, faster. Appreciate you staying.
Yeah, what did it come out to?
Let's see. No, we've been
And this is gonna be kind of snug around your waist here.
13 and a half.
No, almost
My last
matches
one.
your outfit.
Okay, I shaved a minute, but
Alright, is that alright?
not too shabby. I know he wants them to be in there
Okay.
some of the time, but I'm like,
Very good. I'll just
you
put
can
this
just
right
watch
here.
them fast.
so the first item on the list here, Lauren, is gonna be balance. So what we're gonna have you do, I'm gonna have you stand up from the bed here. You're gonna put your feet together. You're gonna hold this for 10 seconds. Okay? Yes, let me see here. So you have to use your legs, bend your knees. Yep, very good. And hold this here for 10 seconds.
It's just so hard to make them.
Good. You doing okay here?
Some interesting conversation pops up and you're like, I'd much rather
All right,
listen to this.
and that was 10 seconds. Very good.
I feel like
Okay, so the next one, Lauren, you can sit back down.
I feel like I've really done
I didn't see you have any difficulty with that, so that was very good.
To an extent, you know.
So the next one here, you can put whatever foot you want in front of the other one, but you're gonna essentially go heel next to your big toe. Okay? So not here, but just kind of out to the side. Okay? You're gonna do the same thing, stand for 10 seconds. Like this? Yes, just like that. Good. Alright, 10 seconds. Good job. Sit back down. The last one here, Lauren, you're gonna stand up. You're gonna put whatever foot you want in front of the other one. This time it's gonna be heel to toe. Okay? You can use your arms if you need to balance. Good. No difficulty with that. All right.
A little more challenging.
A little bit more, okay. Same thing, we'd hold this for 10 seconds. It's been 10 seconds, I'll have you sit back down. All right, good job, Lauren. So that was our balance part. We're gonna go next into our walking, okay? All right, so I'll have you sit on up. Good. Okay, and watch this paper on the floor. Okay, let me move this camera with us. So what you're gonna do, Lauren, is you're gonna come over here to this mark. Yes. I'll have you stand in front of that. Let me find a good spot for the camera. Not sure if that'll work. I think. Okay, let me just make sure. You can see, you can kind of see it. Yeah, that's all right. Just gotta scooch it up just a little bit more. Okay. All right, Lauren, so this is testing your gait speed. And, let's see, need a clock. Borrow your phone, Lauren, and just set a timer.
Timer, stopwatch, whatever you need.
Okay, perfect. Timer. Okay,
Stopwatch is here.
perfect, that's what I wanna do. Okay, so what you're gonna do, Lauren, you're gonna walk at your comfortable pace. And I'm gonna time you at a certain spot. I'm not gonna tell you when, but you're just gonna walk at your comfortable space. All the way down. You're gonna pass this threshold, and I want you to stop.
Okay.
Okay? And then once you're here, I'll have you repeat the same test. So same thing, comfortable spot. I'll time you at a certain spot. Come back to this very first mark and stop.
Cool.
Any
Sounds good.
questions?
No.
Okay. All right, whenever you're ready. Good, and stop. All right, and again, at your comfortable spot. And go. Okay, good job, Lauren. Doing okay? Okay.
Oh goodness, you're like.
Okay, so the next test here, let's go back over to our mat, okay? gonna do is I'm gonna have you stand up from a sitting position. So with this one, I don't want you to use your arms. I want you to put your arms right here across your chest. Good, lean forward, kind of do your own strategy here. Stand all the way up tall, and then come back down. Okay? So let me go ahead and see how you do that. Good. Okay, good job. All right, so we're gonna do that again, only this time we're gonna do it 5 times. And I'm gonna time you.
Okay.
Okay? All right. All right, Lauren, whenever you're ready, and go. 1, 2,
Legs are really weak.
3, 4, 5, and sit back down. Good job. All right, Lauren, very good. So what I'm gonna do now is we're just gonna sit here and talk. I'm gonna take that gate belt off you though, just so you're more comfortable. And I've been talking with your doctor, kind of about how you're doing in therapy, based on your performance, but also on some of the conditions that you're having. I decided to go more of a conservative approach. So when we do any kind of exercise, looking at intensity, we're gonna do some light activity.
Okay.
So that just means I want your heart rate between 40 and 60% of your heart rate max. Okay? And so I did some math here to figure out what that range is gonna be. So for your resting heart rate, it's at 60, which is normal. And then at max heart rate, it's at 145, which is very good. So to look at that, I took resting heart rate plus 40%, the low end of that range, and then kind of in parentheses, I again multiplied that times your max heart rate minus your resting heart rate, got 94 for your target heart rate, the lower end.
Okay.
I did that same equation, but plugged in 60%, and 111 is your target heart rate for like your upper level. Okay? So that's what we're gonna be monitoring and looking for. The 3 activities that I thought would be really good for you would be kind of like light stretching. Kind of, do you like yoga?
Yeah.
Okay, perfect. So light stretching would be really good for flexibility. As we get older, we tend to lose that, so that would be really great and beneficial for you. Also, do you like walking?
Sometimes.
Sometimes? Do you normally walk on a treadmill or outdoors?
Outdoors. I prefer to walk outside for sure.
Okay, very good, I do too. So walking slowly is also a really good activity. So
I can do that.
So anytime after work or just in the evenings, you want to take a nice little stroll, go for it. And then gardening. I kind of picked that. Do you like gardening?
Yeah.
Okay, so that is also like another light activity that you can do. Couple of things just to, because I know sometimes it's hard to do exercise, especially with your schedule and things. So a couple of things I thought about is just incorporating exercises that are of interest to you. Things that you love to do.
Yeah, I can do that. Just keep it on the light end.
Yes, definitely. So whatever you love to do, we can definitely work with that and kind of incorporate that into your exercise. Cool. As far as your schedule, what does your schedule look like as far as
We're tired.
retired? Okay. Very good. So you got plenty of free time for the most part.
I keep my grandkids sometimes, but that's it.
Okay. All right. Well, you can definitely do some activity with your grandkids.
Yeah.
Kind of incorporate that. It's actually more fun to do exercise with a buddy or with a pet even.
Yes.
All right. So those are just some ideas that I have. We'll just work through therapy and figure out how you do. Sound good?
I have a question.
Uh-huh.
On the, you said we were testing my strength. What did I score?
Oh, good question.
Am I strong?
let me see here. You are very strong.
Cause I feel weak.
You feel weak? Okay. Let me actually look at this here. Gotta find all of my papers here. Make sure. Okay. Give me 1 second, Lauren. There's a lot of papers here.
You're okay.
Okay, so you did very well on the balance test.
Okay.
So I'm glad you brought that up because I did want to discuss the results with you. So the balance test is very good. You got 1 point for each, which is the highest point for each. So that right there is a total of, actually, tandem. So the one where you have your heel in front of your toe, that's worth 2 points. So you got a total of 4 points on that. Very good. No swaying or anything, so I'm not too worried about your balance or even fall risk at this time.
That's good to know.
All right, and then as for your gait speed, sorry, this is out of order.
That's okay.
Okay. And you didn't use any kind of assistive device. You felt pretty good on your feet the whole
Yeah.
time.
I don't have any problems walking, I don't think. Sometimes I'm just slow.
Okay, so let me see. And you did 4 meters is what we measured. So you got 4.9 seconds and then 5.9 seconds for the second time. So both of those are pretty good. Let me see. Yeah, so 4.9 was your fastest, so that's good. Let's see, let's look at the comparison here. So, 4.9. So you are right at 3 points for this. So if it took you longer to walk, you'd kind of be at a higher risk here. But 3 is very good. So you got 3 points for that and 3 points over here. So whoops, got 3 points there total. So total of 3 for that section. So next you got your sit to stand. And you did that very safely without any of my help, so that was really good. You stood up without arms. Let's see. And then I timed it 13.78 seconds. Okay, so that would be a 2 for that. So let's go ahead and total up your final thing. Got 4, 2, and okay. So at this point, so looking at all of these measures, you got a 4 for your balance, a 3 for your gait, and a 2 for your sit to stand. That totals to 9 points. And if you look right here, so 4 to 9 is considered reduced physical performance.
Okay.
But there is a good probability of recovery with that. So I really think physical therapy can definitely help you with improvements and improving your function and quality of life.
Cool.
So I'm not too worried about where you are, but I do think there is some benefits with therapy.
Cool.
Okay.
Sounds good.
Very good. Any other questions? No? Okay. Thank you.